Procedure number 1. Direct composite veneers using Venus. In our direct composite veneers case, to be done on teeth 7, 8, 9, and 10, please note we will be using a silicone index made from the final wax-up. We will also be layering the composite in order to match both body and enamel shades. It'll be very important throughout this procedure to not damage the soft tissue, as bleeding will bring this procedure to a halt. In order to close the diastema, align the edges, and improve the color, our steps will be: Step 1. Determine the proper shade selection. Step 2. Prep teeth for composite veneers. Step 3. Etch. Step 4. Bond. Step 5. Apply lingual framework using a silicone stent. Step 6. Separate the teeth. Step 7. Contour the edges. Step 8. Apply new adhesive. Step 9. Veneer each tooth. Step 10. Finish. And finally, Step 11. Polish. Begin by determining the proper shades of the Venus composite using the unique Venus 2-layer shade guide. Please note that all the shade tabs, with the exception of the translucent shades, are already layered. The dentin shades are opaque and will completely cover any underlying discoloration. The back of the shade guide provides you with the formula for creating the layered shades you and your patient desire. The next step is to prep the incisal edges using a veneer burr. The silicone index can be used as a guide to confirm the proper amount of incisal edge has been removed. Remember to widen the space between the teeth enough so sufficient composite can be placed. A thin sliver of the composite simply would not have enough strength. Next, the Gluma etching gel is applied. Because the dentin is not exposed, over-etching of the dentin is not likely. Therefore, the 15 to 20 second maximum limit to etching can be exceeded. Finish by rinsing and air drying only. Now apply the adhesive, Gluma Comfort Bond Plus Desensitizer. 3 consecutive coats should be applied. Wait for 20 seconds and then gently air dry. Follow by light curing. Our next step will again involve the silicone index. Apply a special lubricating agent such as Gluma Solid Bond S to the silicone index. Gluma Solid Bond S is a lightly filled bis-GMA resin designed specifically for this purpose. The index is used to help shape the composite. In this case, we are using Venus Shade Opaque A2, also designated as Venus Shade OA2. It is important to take the opaque material all the way to the edge of the index, which will ultimately be cut off. You need a composite which does not easily set under ambient light. The longer working time of Venus is ideal for shaping the veneer in the index and placing it on the tooth. Once the composite has been placed, remove the excess opaque material off the teeth. The next step is to separate the teeth. Due to the importance of not lacerating the gums, it'll be helpful to score the teeth first to act as a guideline. From this point forward, the letters CEBL will best describe our steps. CEBL stands for Cutback, Etch, Bond, and Layer. After the cutback is finished, dead soft foil will be used to isolate the tooth being etched. This will prevent the bonding agent from sticking to adjacent teeth. Now apply 3 consecutive coats of Gluma Comfort Bond Plus Desensitizer adhesive. Wait for 20 seconds and allow the solvent to evaporate by air drying for at least 5 seconds, followed by light curing. After curing, remove the dead soft foil to prevent a space or gap from forming. You may notice that the doctor in this case applies Gluma Solid Bond S to his glove, which acts as his artist palette. He uses this throughout the procedure for lubrication. Next, Venus Composite is applied. You'll most likely find that shaping the veneer surface is easier with Venus due to its superior consistency. It flows when you move it and stops immediately as you stop moving it. Also, there is virtually no porosity in Venus as it comes out of the syringe. After Venus has been shaped, our doctor creates mamelon's lobes with the edge of his instrument in order to create translucency at the incisal edge. There is no set pattern. The more lobes created, the greater the translucency. To finish the incisal edge, take a small amount of the clear incisal Venus. In this case, we are using Venus shade T2, a neutral translucent color. Roll the material between your fingers into a hot dog shape and place it on the incisal edge to fill in the serrated edge. It's important that this step does not add any length to the tooth other than simply smoothing out the edge. Now, as we begin to blend in the layers, our doctor will use a natural sable-haired artist brush number 6 or number 8 to create the most natural, seamless transition. You will find the consistency of Venus allows for easy blending. Finish by trimming and polishing the tooth to remove the air-inhibited layer so that nothing placed on adjacent teeth will stick to our new veneer. You'll also want to create a slightly less than perfect edge to look more natural. Check for good contact and assure that the interproximal areas are not stuck together. After that, use the thinnest sanding strip possible. We're using Epitex. Never use a metal sanding strip for this step. Finally, we need to add the incisal halo. Since we will be continuing this procedure on the number 9, number 7, and number 10 teeth, we'll apply the incisal halo upon completion of the other teeth. Once all the teeth are finished, it's finally time to add the incisal halo. Etch the edge of the teeth to cleanse. Now apply Gluma Comfort Bond Plus Desensitizer, dry for a few seconds, and light cure as usual. Finish by applying a high-value white color such as Venus Shade SBO, which is super bleach opaque to the edge and light cure. As we do not want to add length to the tooth, you may want to compensate while you are trimming and polishing prior to adding the halo. Now our doctor uses a common sandpaper disc on his drill to round out the corners. The disc he is using is a Flexi Blue disc manufactured by Cosmodent. He will round corners slightly more for women and less for men. During the polishing stage, we will use a composite removing polishing head that is similar to a gritty, hard sandpaper. This will remove the roughness. The final polishing disc is a diamond polisher called Pogo. Our dentists will use heavy pressure at first and then ease up on the pressure to create a high luster. You should be able to get under the gum line without causing a laceration. You will finish with the Epitex sanding strip manufactured by GC America to polish in between the teeth. This is particularly important so stains will not stick to rough areas between the teeth. This case is completed by checking the occlusion and lateral excursions. We find both to be free and clear, which is another benefit of using a silicone index and a wax up in the procedure.